MADM periodic maintenance. This video is intended to supplement MADM periodic maintenance activities. Please ensure that you've read the entire procedure in the MADM service manual before beginning. Removal and replacement of the anesthetic cartridge fitting. You will require the Thornhill Medical MADM anesthetic cartridge fitting kit, containing a quick connect socket fitting, an O-ring, the screen filter, and the valve height quick check tool. You'll need the following tools for this procedure: a 10mm socket wrench, tweezers, isopropyl alcohol, and calipers if the valve height quick check tool is not available. Place the MADM unit in a clean, dry, anti-static environment. Turn the unit off and isolate it from any external power source. Ensure you have some containers available to retain and sort the hardware as you follow the procedure. Locate the anesthetic cartridge fitting at the bottom of the anesthetic cartridge slot on MADM. Place the head of the 10mm socket wrench over the head of the anesthetic cartridge fitting. Turn the socket wrench counterclockwise to remove the fitting. Using a pair of tweezers, carefully remove the O-ring and the screen filter. If you are fully replacing the O-ring and screen filter, they can be discarded. Otherwise, clean the O-ring and screen filter with isopropyl alcohol. Allow the components to air dry in a ventilated room. Using the tweezers, install the screen filter, then the O-ring. Reinstall and hand tighten the anesthetic cartridge fitting. Place the valve height quick check tool supplied onto the fitting to check its height. Use the 10mm socket wrench to tighten the anesthetic cartridge fitting in small increments until the pins protruding from the tool slide and drag under the eject latch. Alternatively, using calipers, ensure that the distance from the top of the anesthetic cartridge fitting to the top of the manifold bracket is 10.6 mm plus or minus 0.15 mm. Verify that the anesthetic cartridge fitting is installed correctly by locking and releasing an empty anesthetic cartridge. Removal and replacement of the Purged Anesthetic Container. You will require the Thornhill Medical MADM Purged Anesthetic Container kit, containing a Purged Anesthetic Container and 2 M3x5 flat Phillips screws. You will need a number 1 Phillips screwdriver to complete this procedure. Locate the Purged Anesthetic Container at the bottom of the MADM unit. Using the Phillips screwdriver, remove the 2 retaining screws and pull out the Purged Anesthetic Container. Ensure that the O-ring is removed as well and does not fall into the system. Ensure that the new Purged Anesthetic Container has an O-ring pre-installed. Install the new Purged Anesthetic Container and reinstall the 2 retaining screws. Cleaning up the heater. You'll need the following tools for this procedure: a number 2 Phillips screwdriver, a 6mm socket driver, a small brush, and isopropyl alcohol. Locate the heater access panel on the bottom of the MADM unit. Using the Phillips screwdriver, remove the 3 retaining screws and the heater access cover. Using the socket driver, remove the 3 standoffs securing the heater cable assembly and bracket. When the standoffs are removed, carefully pull out the heater cable assembly and bracket from the manifold by gently pulling the cables all together. Do not pull on any one cable individually. Remove the O-ring from the recess of the manifold. Clean the surface of the heater using a small brush dipped in a small amount of isopropyl alcohol. Allow the heater to air dry in a ventilated area. Prior to reinstalling the heater, place the O-ring around the heater. Install the heater assembly and bracket and reinstall the standoffs. Place the heater access panel over the access port and reinstall the retaining screws.